Good morning. This is Dr. McDaniel. I'm at the horse farm. Today's Saturday. The girls take horse riding lessons every Saturday. My daughter Jill she is 13. She's been riding since she was 14. Since she was 5. And she's warming up now. Jill's been riding since she was 5 years old. She's 13 now, so 8 years. She's been riding for 8 years now. And so since 2011. And Joy, who's 8, she's been riding since she was 3 years old because they knew her. So we come every Saturday that we're in town. And that they don't have the horse farm closed off for a horse show or competition. The unfortunate part is that I'm allergic to all of the hay and the horses, so I actually took 3 allergy tablets this morning in the hope that I won't constantly sit here hacking. So we'll see if that works or not. We live in New Jersey. There's lots of horse farms out here. I like this one because it's only 12 minutes away from where we live. And unfortunately today we woke up late. We've been coming for 8 years. I've only been late maybe about 6 times. 6, maybe 7 times, and today it was one of those 6 to 7 times, so what can you do? I thought today, since we don't have specific patients that we've seen today to use for example, I thought today we would use, I would talk about some common things that occur during the day. One of the most common things that occurs is UTI, bladder infection, cystitis. So, every day I get at least maybe 1 or 2 people telling me that they think they have a UTI or cystitis. And I probably get about another 1 or 2 more saying that they have a UTI or cystitis and asking if I can just give them a prescription, send it to the pharmacy. They don't need to come in, they've had it before. My rule is that I never, like 99% of the time, I never write prescriptions without seeing the patient. Sorry, and that's for a couple of reasons. One, I know if it's for a vaginal infection, I'm going to need to see her, do an exam. I can only trust my own eyes, my own evaluation. Can't trust someone else's eyes and someone else's evaluation. And if it's a cystitis, bladder infection, UTI, then I want them to come in so I can go through my litany of questions to document. I don't think patients, for the most part, or the layman for the most part, understands or comprehends that as a physician, when I write a prescription, I'm taking responsibility for the diagnosis, the management, and any potential complications, as the lawyers would say, herewith. So if I'm going to take responsibility, then I need to see her, document the evaluation. I need to be able to send her urine for culture, because urine culture is standard of care for diagnosis and treating bladder infection, cystitis, UTI. Now, this farm is pretty large, and we have this inner part here that they have with the horses who are large inside. And they can also clean them, shower them, bathe them on the inside. And then they also have kind of outer ones, a whole bunch of outer ones like this. This one's Apollo. The girls used to love riding Apollo because, of course, he's turned around eating. They used to love riding Apollo because he's so big. He's very tall. Big white horse. And then there's Splatter. They like Splatter because of the way he looks. Ladybug. When they were little, they used to ride Ladybug, but Ladybug's a little slow. So we haven't been on Ladybug in a zillion years. Roscoe used to be a popular one. They read Roscoe. They still read Roscoe. He's pretty good. I think the girls tell me Roscoe is good for being quick, but he doesn't jump either very well or jump at all. So now that Jill's been doing a lot of jumping, she doesn't ride Roscoe. Joy sometimes rides Roscoe because she doesn't jump very much. She jumps a little bit, not very much. And let's see, that one's called Dippin' Dots. These are not the inside ones that are warm. These are some of the outside ones. These are the outside ones that are relatively warm in the winter because they're inside corrals, but they're not totally inside the climate controlled area. Still trying to get a horse. I forget this horse's name too, but I think this is the horse that has one blue eye and one brown eye. I'll find out when she finishes. So she's outside today. It's kind of dark and gloomy inside today. I'm glad the teacher brought her outside because Jill actually hates being outside. She prefers to be inside. And it's nicer to be outside when it's not raining. The last few times, it's winters. We come here in the rain, we come here in the snow. If it's snowing, we're usually the only lesson in the morning, and maybe one or two people come in the afternoon. Joy's walking our dog, Baby. We always bring Baby to the horse farm if it's not raining, because Baby's a Yorkie. She's a purebred Yorkie, and she's less than 5 pounds, so she's very tiny. She's very tiny. So the catch is, yes, when I write a prescription, I'm responsible for that diagnosis, for the management, the treatment, for the prescription. So for medical legal reasons, if I'm going to be held responsible, accountable, or to blame, as the case may sometimes be, I always document that I've seen the patient, document the information obtained, send a culture to either confirm or refute what the diagnosis was. So the patient always has to come in. Now, an interesting aspect to me is, I'm going to say maybe 20% of the time when people come in, they tell the girls, the medical assistants, that they don't know if they have a UTI. They say, I think I have a UTI. I'm not sure. It might be a vaginal infection, which is always, I mean, it's kind of weird to me because the symptoms are absolutely not the same. So how they would think that they potentially have a bladder versus a vaginal infection, of course, doesn't make any sense to me. But I found over the years that the reason why a lot of people say they don't know is because they've read on the internet that a bladder infection will have burning when they urinate. So if they have any kind of burning when they urinate, they often think they have a vaginal infection. A bladder infection or a UTI. But the burning when you urinate for a bladder infection or UTI is going to be in the body. It's not going to be once the urine has touched the skin. A lot of times, if someone has a vaginal infection, they will have burning when they urinate, but that burning is because the urine hits the skin and they have irritation in the skin. That's what's the source of the burning. So that's a big differentiation factor. But if I just had people leave a message, yeah, I'm having burning when I urinate, it's really uncomfortable, that's not enough for us to say they have a cystitis, a UTI, bladder infection. And in reality, that's not what's going on. They need an exam to confirm that they actually have a vaginal infection and not really a bladder infection. So the evaluation for cystitis or UTI is going to be, first I ask them a litany of questions. The first ones, which in all of these you can have one or two all, less than 15% of the time someone will have absolutely no symptoms of a bladder infection, cystitis, UTI, none whatsoever. So 15% of bladder or infections or UTIs don't have any symptoms. So they're what we call atypical cystidities or an atypical cystitis, because they have zero clue that they have it, zero symptoms that they have it. But if we send their urine, and the definition based on the microbiology is greater than 100,000 colony counts, so based on the microbiology, they do have a bladder infection or cystitis. UTI is the general term. It means urinary tract infection. So the questions I always ask are, and I'll explain the questions, since they started feeling like something was going on, have they awakened at night to urinate when they usually don't? And that's because any kind of inflammation in the pelvis or the bladder will cause the muscles, the detrusor muscles, to spasm. And if those detrusor muscles spasm, that spasming is the main reason why people feel like, hello, lucky tune, why they have a bladder infection. But it's also the muscles that spasm when you feel like you have to urinate. So it will spasm regardless of the fact that you're trying to sleep, and it will wake you up with the sensation that you have to urinate. So are they waking up at night to urinate when they usually do not, is the first main question. Second question is, when they go to the restroom to urinate, does it feel like their bladder's really full, but it turns out it isn't? And that's for the same reason. The inflammation, which if they have a bladder infection or cystitis, is due to the bacteria that's present. Bacteria causes inflammation. Inflammation causes the bladder muscles to spasm. So when they go to the restroom to urinate, does it feel like their bladder's full, but it turns out it's not actually full? That's because of the spasming. So are they waking up at night to urinate when they usually don't? When they go to the restroom to urinate, does it feel like their bladder's full, but it actually isn't? When they start to urinate, does it feel like they sit down, they're ready to urinate, and then nothing happens? There's a pause, They have to sit there for a second or two. Finally, a little bit of urine comes out. And the next question, when they finish urinating, does it feel like there's still urine in the bladder? It just doesn't want to come out. It feels like it's just sitting there. They have to bear down or try to force the urine out to get rid of that sensation, or just nothing happens. And either during urination or as soon as they finish urinating, is there any pressure, discomfort, pain, burning, unusual sensation? And that would be due to the irregular and the uncoordinated spasming or contractile activity of the bladder. So those are the first ones. I'm trying to keep these down to 10 minutes or less. I realized I think I talk a lot, but sometimes that's a blessing and a curse to talk a lot. Patients like it when you explain things really well, but then of course the visits take longer. Sorry. So tomorrow's Sunday. I'll finish this on Sunday. It's not very long. So the main thing is when someone feels like they have discomfort, it's really inappropriate to just call and ask for a prescription over the phone, because you don't have any evaluation in terms of what your signs and your symptoms are, and you're not able to leave a urine sample to see if the culture confirms that you really do have the definition of a bladder infection, cystitis, urinary tract infection, UTI, which, as I said, would be greater than 100 colony counts. So the best thing to do is to always come in for that evaluation, the signs and symptoms confirmation, and to see, to send the urine for culture. That's the last little look at Jill there, doing her. She's a little bit tired today. We all went to bed late, so that's why we got up late and got here late today, because we went to bed late. So that's the first half, and the first half of the series of questions is, are you waking up at night to urinate when you usually don't? When you go to urinate, does it feel like your bladder's full when it really isn't? When you start to urinate, does the urine flow as soon as you want it to, or do you have to wait a second or two to flow? Either during urination or as soon as you finish urinating, is there any pressure, discomfort, pain, burning, unusual sensation? We call that dysuria, and that's where people get the confusion that if they're urinating and there's burning, it must be from a bladder infection. That's not always the case. And then I'll finish everything up on the UTI issue tomorrow. So I hope that's been helpful. This is Dr. McDaniel at GYN Corner. I'm at Baymar Farms today. It's Saturday here in New Jersey because girls take horse riding lessons every Saturday since, I don't know why I keep spacing on the year, since 2011. Thank you for watching, and I'll be back tomorrow, hopefully early tomorrow, Sunday morning. I'll be back tomorrow to finish the UTI information. Thanks, and have a good Saturday.